I'm going to speak about gluteus medius. So the origin is from ilium. The insertion is greater trochanter. Action is abduction and medial rotation at hip joint. The nerve innervation is superior gluteal nerve. The main significance of gluteus medius is it's the main abductor at hip joint.
Go.
Okay, so for the gluteus minimus, the origin is the ilium, the insertion is the greater trochanter, the action it abducts and medial rotates, and the nerve innervation is superior gluteal nerve.
Our last muscle is the tensor fascia lata. The origin is the iliac crest. The insertion is the tibia by the way of the iliotibial tract. The action is flexes and abducts the thigh, and the nerve innervation is superior gluteal nerve.
Have your partner lay in a side-laying position. Isolate the shape of the gluteus medius by placing the webbing of one hand along the iliac crest from the posterior superior iliac spine to nearly the anterior superior iliac spine, while the other hand locates the greater trochanter. Your hand will form a shape that looks like a slice of pie. This is the outline of the gluteus medius. Palpate this area from just below the iliac crest to the greater trochanter for the dense fibers of the gluteus medius. Ask your partner to abduct their hip slightly, and you will feel the medius contract. The gluteus medius abducts the hip, the anterior fibers flex the hip and medially rotate the hip. The posterior fibers extend the hip and laterally rotate the hip. The gluteal surface of the ilium, between posterior and anterior gluteal lines, just below the iliac crest, is the origin. The insertion is the lateral aspect of the greater trochanter, and again, the nerve innervation is the superior gluteal nerve. Have your partner lie in a side-lying drape again, and isolate the shape of the gluteus medius by placing the webbing of one hand along the iliac crest, while the other hand locates the greater trochanter. While your hand will form the shape that looks like the slice of pie again, this is the outline of gluteus medius. To find the gluteus minimus, sink your fingers deep to the gluteus medius to explore the density and mass of the gluteus minimus. The gluteus minimus abducts the hip and it immediately rotates the hip while flexing. The origin is the gluteal surface of the ilium between the anterior and inferior gluteal lines, and the insertion is the anterior aspect of the greater trochanter. The nerve innervation is also the superior gluteal nerve. You may have your partner abduct their hips slightly to feel the minimus contract. The gluteus minimus lies deep to the gluteus medius and is inaccessible. However, its dense fibers can be felt beneath the medius. With your partner in a supine position, locate the anterior superior iliac spine and place the flat of your hand posterior and distal to the anterior superior iliac spine and iliac crest. Ask your partner to alternate medial rotation with relaxation of the hip. Upon medial rotation, the TFL, which is the tensor fascia lata, will contract into a solid oval mound beneath your hand. Palpate its vertical fibers and outline its width and follow it distally until the tensor fascia lata blends into the iliotibial tract.
Okay, so now we are going to see where gluteus medius originates from. It originates from gluteal surface of ilium between posterior and anterior gluteal lines below iliac crest. and it inserts into the lateral aspect of greater trochanter.
And now the gluteus minimus. It originates the gluteal surface of the ilium between the anterior and the inferior gluteal lines. The insertion is the anterior aspect of the greater trochanter. The last one is the tensor fascia lata. It originates in the iliac crest posterior to the ASIS. The insertion is the iliotibial tract, also known as the IT band.